What are high-risk versus low-risk HPV types? Imagine a tiny virus that can hide in your body and sometimes cause health problems. That's human papillomavirus, or HPV, a common virus transmitted through skin-to-skin contact during sexual activity. But not all types of HPV are the same. Some are more likely to cause serious issues, while others are mostly harmless. Understanding the difference helps us make better choices about prevention and health. Low-risk HPV types are generally not linked to cancer. Instead, they tend to cause benign conditions like genital warts. The most common low-risk types are HPV-6 and HPV-11. These two are responsible for about 90% of genital warts, which can appear on the genitals, around the anus, or even inside the mouth and throat. While these warts can be bothersome or embarrassing, they usually do not lead to cancer. Sometimes, low-risk HPV can cause mild cellular changes called dysplasia, but these changes are not precancerous and often go away on their own without treatment. Most infections with low-risk types are cleared naturally by the immune system within a couple of years, meaning they don't cause long-term health problems. High-risk HPV types are a different story. They have the potential to cause cellular changes that can develop into cancer if the infection persists. There are at least 14 high-risk types, with HPV-16 and HPV-18 being the most significant because they are linked to about 70% of cervical cancers worldwide. Other high-risk types include HPV-31, 33, 35, 39, 45, 51, 52, 56, 58, 59, 66, and 68. These types can cause cancers of the cervix, anus, penis, vulva, vagina, and parts of the throat like the tongue and tonsils. It's important to note that most high-risk HPV infections do not lead to cancer because the immune system often clears the virus within 2 years. However, if the infection persists over many years, it can cause cellular changes that may develop into cancer. From a prevention perspective, knowing the difference between high-risk and low-risk HPV is key. Vaccines available today protect against both types. They cover the low-risk types that cause genital warts and several high-risk types that can lead to cancer. Regular screening tests like Pap smears and HPV tests are also vital. They help detect high-risk infections early, allowing for monitoring and treatment of any precancerous changes before they become serious. In summary, low-risk HPV types like 6 and 11 mainly cause genital warts and rarely lead to cancer. High-risk types such as 16 and 18 can cause persistent infections that might develop into cancers of the reproductive organs and throat. Understanding these differences empowers individuals to take steps to reduce transmission, including vaccination, practicing safe sex, and getting regular medical screenings. Always consult healthcare professionals for personalized advice and to stay informed about the best ways to protect your health.